Let's make a chair. Let's get a chair.
It's now 11:15. I'd like to call this meeting of the hospital board to order. And we do have a quorum. Jim and Tanya both are not here today. And first, we'll start with public comment. And due to the number of people, well, let me see. Okay. No, I think we can do it. Okay. I just wanted to be able to do this in an organized manner so that everyone that wants to speak has a chance to speak. So we'd like to limit it to 3 minutes so we can get through this and everyone does have a chance to speak. And I just want to, I have a couple of statements that I want to cover prior to that. Preface that we are unable to comment on personnel matters or issues where there is potential litigation that's pending. And it's not a press conference. And just to remind you that the public comment, why it exists to allow the public so that you can participate in the business of the hospital, and that the hospital does not, the hospital is not employers of the primary care providers, just so you know. And then I have a statement with regards to some of the recent things. That recently we received media inquiries regarding personnel changes in the status of the Innovations Grant. The Mineral Regional Health Center oversees the grant, not the hospital, and that's really the proper entity to deal with such inquiries. And as to the personnel issues, we will not comment publicly on the confidential personnel issues, and then we understand that there is an open letter that has been circulating in the community, and while much of that letter involves confidential personnel issues, we can tell you that the author of that letter is not currently associated with the hospital or the health center, and was not associated with either on the date of that letter. So with that being said, the first person I have on the list is Peggy Stevens.
Yes.
Go ahead.
Thank you for allowing me to take the time to talk, and I just want to assure you I'm here as a private citizen. I've been a community member since 1979. So I do have some concerns in regards to the letter George Bailey wrote and his position with this facility. And the point that I'm most concerned about is the firing of Dr. Patterson. I just want to show you a letter of support that was written by Barb Jasper, who is a RN here for 19 years, and also a petition that was circulated amongst the community members and signing it in support of Dr. Patterson. I guess my concern is very rarely do we get good physicians that are willing to move here. And certainly very rarely do we get one that want to be a part of our community, that actually have their kids going to our schools. And according to Barb's recommendation, it seems like he had a high standard of practice. And there is a standard of care that we are all mandated to operate under, and it seemed like he operated above and beyond that. And his termination to me, just personally, it seemed unwarranted. And I would request the board to review that again and to possibly reinstate Dr. Patterson. I think it's your responsibility as board members to listen to the community members, and here it shows that there is definitely support for him. And I'm not sure what kind of standards boards are operating under, but certainly listening to the people and the viable interests of the taxpayers would be one of those. And since we have a lot of people to talk, that's all I'm going to say.
Good for you, Peggy. 2 minutes.
Thank you, Peggy. Thank you, Peggy. Lori.
Well, I'm kind of here both as a county commissioner and a citizen. First, as a county commissioner, we have requested numerous times to get copies of the minutes of the board meetings, and we have yet to get any. So
My understanding they have all been filed with the clerk.
I don't know.
Yeah, they have.
They have.
Have they?
Yeah.
And then, I've been kind of asking, why is there, 2 boards? We have a hospital board and a clinic board.
Yeah.
I'd like to have clarification on why there are 2 boards. And then, on the hospital board, you have 9 members, am I right there?
Uh-huh.
5 of them are elected and 4 of them are appointed. And just clarification on
Okay.
why are there 4 appointed members and only 5 elected members? It seems to me like, you know, when the hospital district was first formed, there was, you know, I mean, it's the public that are voting these members in. Yet it doesn't seem like those 5 voting members seem to get outvoted on everything by the appointed members. And I would just like clarification on why how 2 boards came about and why all these appointed members.
Maybe we can sit down at some point, because that's kind of a lengthy historical discussion. But can we do that?
Well, I mean, I don't know if the rest of the public want to know, you
Okay.
know, I mean.
We'd like to know.
I think we should all hear that.
That's right.
Is it private?
No, it's not
No.
private. It's not
No.
private whatsoever.
Oh.
It's more a matter of, that's a really lengthy discussion to go through. And maybe that's something that we can put on the agenda for the next month, where we can explain really how this all came about and how it's currently structured. Because I think we all understand it as board members much better over the last several months that we've been really
Well, it
digging
just
into this.
seems like the public doesn't have any say anymore.
Yeah.
I just for part of that right up front, I will tell you, I've only been on the hospital board as an elected member. This will be, what, my 3rd meeting, I guess it is. I've yet to see one instance where there was a split vote, that the elected members were going one direction and the
Right.
appointed members were going. It was, it has almost always been a consensus vote where everybody went the same direction. So it's certainly not accurate from what I've seen to say that the elected members are getting outvoted by the appointed members. It hasn't been happening that way at all. Everybody's talked things over, reached a consensus, and then the elected or appointed, the votes have gone from.
Who does the
And there are,
Who is-
and there are 5 elected members,
Right. Yeah.
as opposed to the 4.
There's 5 elected and 4 appointed, right?
Right. Well, and it's a more complicated structure actually than that.
What do you mean?
I know.
In short, though, do you know why the appointed members came about?
I think originally it came about, almost 30 years ago, but from what we've been able to dig up, it came about as a result of being able to bring in outside experts. The way that I saw it, that they were able to bring out experts from Missoula hospitals, and because we originally were part of I'm trying to
Missoula Community.
Exactly. We were very closely affiliated with Community Hospital in Missoula, and so we wanted to be able, well, not we, I wasn't on the board at the time, but to draw some expertise onto the board from these outside entities that were outside of the county.
Who appoints?
The board does. And currently, the appointed members would be myself, Lloyd, Gary, and Tanya Brummett are the appointed members.
I sat on the board in the early 90s, and the purpose of the appointed members was to give Community Medical Center a voice in what went on here, because when they initially formed their alliance, there was some monetary interest the community had, so they felt that they needed a voice. And that alliance now is defunct, and the appointed members have remained.
Well, I sit in on a lot of appointed boards, but I'm not a voting member. I mean, I just think that, you know, you can have an appointed board to have some input, but as far as being a voting member, you know, I just think that,
I think if you really want to figure this out and see where it came from and the direction the hospital's going today, Madeline Fowler would be a great resource because she was here when that formed. And she could probably give you an idea of what the thinking was when they made the appointed members at the time. But the purpose was to give community hospital a voice.
That's
and
what I
vote on
understood.
it.
Thank you, Terry. And it had even evolved from that because it didn't used to be that all 5 elected members were on the nonprofit board. So, I mean, there's been an evolution of how that's come about. So that's a really good question. I think that we need to put together something to help everyone understand how this process has gone about.
Well, Bill, a couple of months ago, addressed this.
He helped us to
Yeah,
understand it
you're
because
right.
we didn't really understand it either.
The hospital attorney addressed this at length to the board and how it came about and why, and that it was reasonably put together, and the legal paperwork is all there as well.
It's
well, I
not
just
something
think
new.
that in light of what's going on, that maybe that should be something to be looked at and maybe restructured.
Okay. Yeah, it's certainly not something new. It's something that happened that I think before any of the present board members were involved. None of us were involved when that
Right.
happened, so.
But I think it's something that should maybe be looked into and.
Okay, thank you, Lori. Colleen?
Okay, I'm gonna change gears here.
Okay.
My husband was asked to do this construction that's going on here. I still have it on our computer. And he asked if they were going to use grant money to pay for this, and he was told yes. And he said, well, then you have to put it up for bid. You can't just hire me, which is what they were trying to do. To do it, you have to put it up for bid. So then we got to thinking, this is down the line after they've had this grant for a long time, after the new CEO's been hired and everything. Did they not put it up for, did they advertise for the new CEO, or is this just a buddy from Utah that you hired for the new CEO, or was that advertised?
Are you talking about the
The
mammography?
Suite?
what's the
From
this?
the hospital? Is that?
Is that what he worked on? Was
No, he didn't work on it. He was asked to work on it. He was given the job. He was asked to do the job. And he told them, if this is on grant money, you have to put it up for bid. And they acted like they did not know that. Then they put it up for bid. So I'm wondering, did they know they had to put it up to advertise to get this new CEO that they hired? Did they do anything through protocol? If this is one thing that they didn't, you know, this is just one thing I'm mentioning, that we noticed that they tried to hire my husband without bidding it out. Did they bid out the CEO job? Did they advertise it, or did we just get somebody from Utah, a friend from Utah, for this new CEO job?
If you're talking about the mammography suite, that's a privately funded grant.
But
And
it
I
was
think-
bid out.
I was pretty sure it was bid out because I
Yeah, but
remember
it wasn't
seeing the
at first,
bids.
because I've still got it on my computer. They tried to hire my husband.
I don't know anything about
And he
that.
told them that they had to have it up for bid. So that got us to thinking, with this interest in this funding money, did they advertise for this new CEO that we have? Or was that just given, hand given to somebody from Utah?
There's not a new CEO.
You mean the
I'm a
COO?
COO, if that's who you're talking about.
Yeah.
I'm a COO, not a CEO.
Well,
And there's lots of different grants. You know, this was a specific grant just for the mammography.
And it didn't have to be
Completely
advertised?
separate. Completely, a private funded
okay.
grant that's,
Well, it was advertised then after my husband told him it had to be advertised.
I don't know about that part, but
Well, it's on my computer.
just so you understand that the innovation grant is separate, and this mammography grant was from the Hemsley Private Foundation that's completely separate.
Okay. But my point is, did we follow protocol to get another CE, whatever? Yeah, or was
I-
it just hired from Utah as a Mormon friend?
No, that's not
How many
accurate.
people were advertised?
I know of at least 3.
It was advertised.
I guess your question is kind of a personnel hiring question, and that is the hospital obligated or legally bound to advertise open positions?
Yes.
And, I mean, critical access hospital and federal funding, I believe, we're required to advertise any open position, whether it's administration, nursing, and I think it has to be publicly advertised, and there has to be a certain amount of time passed before you can hire. Am I right?
Is that?
Yeah, and I believe that was the case.
Did you research that for me?
Sure. I wrote it down.
Thank you.
Leona.
My main reason for being here today is to get Dr. Patterson, my doctor, my mother's doctor, rehired. I don't think he was fairly dismissed. I think that's been brought out in public now. How many patients did you see at the clinic last month? Can somebody give me that figure? Should be in your paperwork somewhere.
632.
Okay. I have petitions in my office signed by 258 people who want Dr. Patterson back. They have been reviewed by Lori Johnson. I will not give them to this group because there are signatures from people from the hospital and the clinic who fear for their jobs if their names are known. That's a lot of people, a lot of patients that want their doctor back. And I see no reason whatsoever why he should not be hired back. He is a moral man. He is an excellent doctor. And we want to see him back in the clinic and the hospital. And I believe that is why most of us are here. You now no longer have I don't know what George's title was, but he's gone, which I believe leaves quite a bit of on a yearly salary, leaves quite a bit of money available since you're no longer paying his rather large salary. Has anything been done about remodeling the 2 available rooms into more rest home rooms?
As far as there has been some discussion about that being at maximum capacity. It's not really, from what I understand, it's really difficult to add on to that, and I don't know structurally why that was.
Well, when we talked about it several months ago, Mr. Updike said that there were 2 rooms that could be converted to this if the money was available.
No, what rooms are we talking about?
I don't know, you didn't say, you just said that
we
there
were
was
discussing the assisted living.
No, not the assisted living, the rest home.
The
in
nursing
the
home.
hospital.
Okay.
And you said it was always full with a waiting list.
Oh, I was.
Mr. Updike said he thought there was a couple of rooms that could be converted into 2 new rest home rooms.
I was referring, I was referring to it.
But the money was not available.
You're talking about assisted living?
I was talking about the rest home.
I was talking about assisted living at that point. So,
Okay.
go ahead, Leon, sorry.
Is everyone using NextGen?
You mean countrywide?
No,
Or
here. Are all the doctors and PAs using the NextGen?
they should be.
They should be, but are they?
I couldn't answer that question.
They're not.
No, they're not. And I guess my final question would be, have all the grants been audited or just the innovation grant?
We're looking at that. We're in the process of dealing with that.
Yes,
Right. The innovations grant was not audited. There were specific allegations made, and those allegations were investigated.
It was never audited?
It was not audited.
It's
Well, it's
a
been part of the
technical
annual
term.
audit, but what just occurred was an investigation, not an audit. An
It's a
audit
CPA
takes-
term.
Yeah, an audit takes more time, is something different. And I'm sure we will be looking at the issues going forward of doing audits. But initially, what we did is we received specific allegations and we brought in an outside party to investigate those allegations.
Thank
I
you.
apologize, I have to leave. I have a flight I have to make. Thank you.
Thank you, Leona. Wayne?
Me?
Yeah.
Basically, it's been covered. Our question was, with Dr. Patterson, is he being reinstated? Is that being looked at? We certainly support him. Best doctor we've seen since we've been here, as far as we're concerned. And don't know the circumstances about how he was let go, but we were certainly disappointed, and has forced us to move our care to Missoula. We'd like to see him back.
Okay. Thank you, Wayne.
Do you have an answer for his question? What is being looked into?
I can't discuss that. You know,
It's not personal, he's
Oh,
asking you
okay.
what's being done to look into.
the hospital board is not doing anything to look into that because we don't employ the primary care providers.
Who does?
The health center does. Dr. Houlihan?
I'm waiting for the clinic meeting.
Oh, okay. Lance, go ahead.
For the record, my name is Lance Jasper. I represent Dr. Houlihan, Denise Trader, and other employees with regards to the Monroe County Hospital and the clinic. I have just a couple questions. One is on May 22nd, 2013, I sent a letter to this board along with another board. And it's my understanding that that letter was not received by all members of this board. I would like to know who this person was that was responsible for not giving it to the other members.
Can I even answer that question? I don't know if I can even answer that question.
Did anybody get the letter?
Yes?
Who got the letter?
The board chairs received the letter.
And it was the board chairs that decided not to give it to the board members?
We don't typically give copies of things to everyone. We have them review them, is what we typically would do.
So in this case, it's fair to say that the actual board members didn't get to see this letter?
That's not a true statement either.
So one board member?
No, that's not a true
What-
statement
on
either.
this board, who saw my letter?
You know what, I can't even talk about that.
I'm not
There's too
asking
many.
you. I
No.
know you did.
Okay. And
I didn't see the
You didn't see the letter.
No, this is May. This is the old board.
Yeah, I don't know what, I can't remember when.
Yeah, and I'm in the same boat.
Or
It's
sometime
like-
May, June, I don't know.
Yeah.
It was after the new board took place.
yeah,
that's- I think it's April was the
I
election.
can't address
Was it
that
April or
question
May?
right
May
now.
7th.
May 7th.
Yeah,
May 7th was
I-
I cannot address that question right now.
That would have been our, right,
First
our
meeting,
first board
yeah.
meeting, yeah.
Was it addressed to the hospital board or the?
Both
clinic board
boards
or
it was
both?
too.
The cover sheet was addressed to the health center board.
It was mailed to both boards. Currently, who is the CEO and in charge of the hospital?
The CEO? or
Yeah, who's in charge currently of this?
Steve Carty.
I've lived here 43 years, and I think I know most everyone in this room, at least on the board. And I know that the importance the hospital plays in the community, more probably as much as anyone. It's clearly the single most important thing this county has. It's
That's right.
not only the fact that it serves this community, but I-90's corridor, more people enter the state of Montana through this area than any other spot in the state.
That's right.
And it's really important, I think, that people remember is it's the quality of care that bring people to this,
That's right.
this hospital. And the fact of the matter is, it doesn't matter if you have a barn, but if you have a doctor that people like, they will come. I came back when the care I felt like was at a level that I would trust my family with and put them here. The problem is, you've got a situation where the trust is gone. And the focus, it seems like, is gone from being what it needed to be. And it seemed like for a long time that was back on track. But then it seemed like the board got diverted, I don't even think by their own choosing, but there were false dreams and false hopes sold to us of these grandeur ideas that turned out to be just that, and got suckered into something that wasn't necessarily the focus. The reason I asked if you got my letter is because I know all of you, and the reason I sent that letter was because I could see that you were being brought into a situation that you knew nothing about, that was going to explode like a nuclear bomb in front of you, and you'd be sitting here like you are today, trying to defend yourselves from something you knew nothing about that was taking place, and to give you that cover so you could say, let's go out and take a look at this. My understanding at this point, it's been looked at, it's been confirmed, but yet really nothing has been done about it to prevent the continued harm that's taking place. I had, James Patterson is a friend of mine. His daughters live next to me. I had to explain to my 5-year-old why their kids had to move. And the fact that George Bailey sent that letter out. How do you explain to him that a doctor with 2 children that wants to live in this community, that's a big part of the search and rescue, that's a big part of being a part of our community,
That's right.
is forced to leave here, when that's exactly what we want. We want people, you know, Dr. Smith, he drives his planes to work, and he takes everybody from the West End there. Well, we need those doctors like Dr. Smith and Dr. Patterson here, to where people are coming from planes, coming from the West End. They're not going to Wallace. They're not going to Missoula. They have their confidence here. You have people like Laurel, who is a great PA, that you have to build on these steps. But it takes someone with confidence that people have in them, like a Dr. Smith or a Dr. Patterson.
That's right.
Just have yourself believe that when I go there, and if I'm really sick, I'm not gonna get sicker. I'm gonna get better.
That's right.
And that's what you gotta focus on. This other stuff that when we send it out is stuff that's getting spread out like a cancer. And that's when it was brought to your attention, it was a tumor. Now it's spread. And now unfortunately you guys are sitting here, and that's what I tried to do in the beginning, was to show you the tumor, cut the tumor out, kill it, and be done with it. But now I am afraid that if we don't get this opportunity to bring back what you have and lose it, then who in the hell in the right mind would come here and practice knowing that this is the standard operating course here?
That's right on.
And so please consider what these people are saying. And it's not just one, you got 250 people here. I am the last person, despite what you may think, that wants this hospital to fail. I purposely live out here. I could drive 120 miles a day to work. I chose to raise my kids here because Mineral County to me stands for what the best thing about it is. The community is the community. You get to say hi to everybody. You get to know about each other, even though that sometimes that's a detriment. Everybody knows your business. But if you have a sick friend or a sick person, this county will rally around it better than any single county. And I choose to drive that extra. That's what we should be doing, is rally around the hospital.
That's right.
And get the people here that need to be that care. And you know what? It'll be forgiven. People forgive it. But don't do the wrong thing here and think that this simply goes away, because it won't. So I implore you to work towards that goal. Work to building that same thing that Dr. Doyle, Dr. Park, Dr. point is, Dr. Smith, that they enjoyed was the fact that you'd see your doctor, you wave. You know, Dr. Park was probably the hardest guy in the world to get a straight conversation where he wasn't telling. When I told him I was a lawyer, I thought he was going to kick me out of the clinic. So I just try to bring that back. Try to make that your focus. Number one, just patient care. So there's that trust. So no one, it can't fail here. It's too important.
Okay, Lance, I know you're never timed in the courtroom, but you've
I'm
gone
fine.
way over your head.
I didn't even want to talk to you.
Thank you, Lance. I think we're not as far apart as you think we are, what our mission is. Tim Buchanan?
Yeah. I house two businesses under one roof. One of my businesses works strongly with the hospital. I do DOT and non-DOT alcohol and drug testing. I've gotten to know a lot of the employees here, and they're awesome. What bothers me, though, as I go out into the community, about every 3 months, there's a bad rumor about the hospital. And there's a good portion of the locals that are fueling it without even looking into why or what is being said. There's a lot of rumors that I can dismiss because of the people I work with, and it bothers me hearing these rumors. I know this community does not want this hospital to fade away for a couple of reasons. One, you lose your health care. Two, this hospital is one of the main establishments for employment. We lose this hospital and the town's done. So I think it